My name is Janice Yoon. I'm a program manager with the Office for Diversity and Inclusion here. It is my pleasure to welcome our alumni fellow, Aaron Hopkins. Hi, Aaron. Can you tell us a little bit about yourself?
Hey, Janice, pleasure to be here. Thank you for highlighting me for the Administrative Fellowship Spotlight today. As you stated, my name is Aaron Hopkins. I was the second fellow at Mount Sinai Hospital. I started the program in 2018 and concluded in 2020. Um, I'm from the Bowie, Maryland area in Prince George's County. I received my master's in health service administration at the University of Michigan, as well as a bachelor's of science in biology at Morehouse College. And currently, I work here at Mount Sinai Health System as an administrator for clinical operations for our Mount Sinai Doctors Westchester practices. And it's a pleasure to be here today.
Thank you, Aaron. So my first question to you, Aaron, what was your biggest takeaway from the Administrative Fellowship Program?
I would say some of the biggest takeaways I had as the fellow, just to give a little bit of context, I was the second fellow at Mount Sinai Hospital as the program was relatively new. And I think the biggest takeaway I got from it was one, if you don't ask, the answer is always no. And when you do ask, and if you do get what you want, you have to make sure that you're always prepared. And what I mean by this is, being the second fellow at Mount Sinai Hospital, we were given a lot of exposure to a lot of different high level executives as well as clinicians and non-clinical staff here at the hospital. And just being able to attend certain meetings, being able to ask to work in different departments and even work with various leaders was a real opportunity that I took upon myself to really explore. And I'm really glad that I was able to be in these different situations, in these different settings. And had I not asked my different preceptors as well as mentors to have these opportunities, I don't think it would have gotten me to where I am.
Thank you, Aaron. So my next question to you is, why did you apply to the fellowship program?
Yeah, so one of the reasons I applied to Mount Sinai Hospital's fellowship program, particularly, was the fact that it was at a top AMC. When looking at different fellowship locations to apply for, some are nonprofit organizations, some are for profit, some have the academic clinical medicine piece, and that's something that I really wanted to be a part of in an institution such as Mount Sinai Hospital, which is world renowned for the clinical care that they provide to patients. Another area was the fact that it is located in New York City, which is the most competitive and largest public healthcare market in the US and if not the world. So being able to work in an environment like New York City, which is very diverse in terms of the type of patients that we're treating, I think was a benefit and an opportunity that I didn't want to pass up on. Another point is having the opportunity to work in various different hospital departments here across the hospital as well as the system. I had the luxury of working in our patient experience department, ambulatory care operations, strategic operations, and internal consulting, as well as joint ventures and business development. And I think had I not been at Mount Sinai Hospital and in the system and organization that offers so many different types of opportunities, so many different types of departments, I feel as if I would have been cutting myself short. And I think lastly, the key thing here was the mentorship. Being able to work out of the office of the president and be able to work with different high level leaders across various departments and doing a lot of amazing things here at Sinai, I thought was really beneficial to my growth and professional development, and really all tied into me wanting to pursue and actually complete a fellowship at Mount Sinai Hospital.
Thank you for that, Aaron. So my next question to you is related to your current role. You graduated from the fellowship program in 2020. So can you tell us a little bit about what you do on a day-to-day in your current position?
Yeah, so I would say it's interesting because I completed the fellowship program in the middle of COVID. Our graduation, as you know, was in June. I actually transitioned into my role as administrator in May of 2020. So really started my new and current role in the middle of the pandemic when things were still getting figured out about what's going on with the pandemic. How can we actually still keep our staff as well as our patients safe here? So really was blessed to get the opportunity to work as an administrator for our Mount Sinai Doctors Westchester group. So I have the financial and operational oversight for multi-specialty physician practices in Westchester. I support around 15 providers and 30 staff members. We provide services such as internal medicine, cardiology, thoracic, radiology services, lab services, and even COVID testing, just to name a few. So because of all this and working in an environment such as healthcare, no day is the same, but on an average day, we try to make sure that our clinical practices are running as efficiently as possible. Patients are able to be seen in a timely manner. We're providing the highest level of care for them to be seen, and also making sure that we have the adequate supplies such as PPE and other medical equipment needed so that we can deliver the level of care that is consistent to being a Mount Sinai Hospital department and facility. Another part of my job is dealing with the strategic planning for Westchester County, assisting our regional leadership, as well as different physician acquisitions, performance improvement initiatives, as well as different network development type initiatives, just to kind of make sure that we are being able to provide care and finding different ways to engage patients in the Westchester market so that they can be a part of the Mount Sinai family.
Thank you so much for that, Aaron. So my next question to you is not so professional. I do want to know a little bit more about you on a personal
Yes.
note, if that's okay. Can you tell us a fun fact about yourself?
A fun fact. Okay, this is a good one. So when I was younger, I was actually born left-handed, and I used my left hand for majority of my life. However, when I was about 5 or 6 years old, I actually became right-handed because one of my teachers told me that most people in the world are right-handed, and really like kind of forced me to do things like drawing with my right hand, writing with my right hand, and so forth. But I would say the benefit to that is that I'm also somewhat ambidextrous, so I can use both hands pretty proficiently. So
That's all.
interesting fact, but yeah, a fun one that I think.
When you're in a rush, you can write with either hand. You don't have to.
Yeah, I'm a little out of practice now, but I think if I started doing it a little bit more with my left hand, I could get back to being pretty competent.
No, that's awesome. All right, Aaron, thanks so much for joining me today for the Administrative Fellowship Spotlight. It was a pleasure getting to know you even better. I feel like, we've already known each other for a couple of years since I've
Yes.
joined the office, really, but today's session definitely helped me learn a little bit more about you. And I'm very happy and proud of, your accomplishments and the fact that we're able to recruit a talent like you into our organization. So thanks so much for your time, and I'll see you next time. Thanks.
Yes, Janice, thank you so much. And big thanks to the ODI department for even having this program here, again, giving us the opportunity to learn and to grow in an organization such as Mount Sinai Hospital. So great connecting. I hope to see you soon and take care.
Thanks so much, Aaron.
All right, take care. Bye.